Hey everybody, just wanted to say a quick hello. It's Dr. McGrath, and I'm here with a very interesting and fun follow-up with my patient, Christian. And Christian, we did surgery on him about 4 months ago. We did a big case, big 3,000 graft case. And what's interesting is, as you all know, I've used quite a bit of the extracellular vesicles with treating my patients. And one of the things that we notice when we use it in conjunction with surgery is how rapidly the grafts start to come in. So he's at 4 months now, and he's already starting to be blown away. We're normally at 4 months, maybe we'll see 10 to 20% of the growth. He looks like a normal guy that would be at 8 to 10 months. So I think it's an interesting video just to talk about that, because this is not the norm. And when you see the before photos, you'll understand. So that's one of the things that always gets me very excited when we talk to patients about how we can augment the procedure, things that we can do to make it better. And even he is like, oh my God, this is just 4 months, and are you telling me I have like maybe at least 50% more growth yet to go? And the answer is yes. So we're very happy. He's got great growth already, and I think it's just going to get better and better. So I'm happy, he's happy, and we're all good. So just again, showing you what we can do, and it's revolutionary, and it's been very, very helpful with our patients and with the success rates that we're seeing.
Hey everybody, I'm Steve Cook, and I'm here again down in Austin with Dr. McGrath. They invited me in for a follow-up with one of my favorite patients that I've worked quite a bit with. This is Christian. How you doing, Christian? Welcome back.
Doing great, Steve. Thanks.
Awesome. Well, Christian's got a great story. I mean, what sticks out in my mind with him is he had a lot of questions. Now, some of you out there might be smiling and saying, oh boy, oh no, what do you mean by that? And really what I mean by that is it's refreshing. He had reached out to me online, and I said, hey, what questions can I answer for you? So I'm the one that took responsibility for that, and they were all great questions. So Christian, you're at 4 months now and had your procedure with Dr. McGrath in Austin. And so far we're looking really good. The hair is looking really strong, and you're just getting started. So I know we're all excited and waiting with bated breath for the rest of the hair to come in. How's your experience been so far in regards to the recovery and the first 4 months?
It's been fantastic. The recovery was really, really simple and quick. It was painless, which I wasn't really concerned with, but had a few hesitations with just what am I getting into. I've never had any other surgeries done before. Super not painless at all, and very quick. The hair started coming back in. That sort of shocked me is almost as soon as the first round started falling out, hairs were coming back in. It was confusing to see, are these about to fall out, or are they coming in? And in fact, they were coming in. So I was very surprised and happy to see how quickly the hair came back.
So the point being is that you went to doctors, you had gone to clinics, you were concerned, which everybody should be when starting a family, and a lot of these things are kind of caught in the minutia out there in regards to what's online, what's believable, what's misinformation, and of course, because we spent so much time speaking together, there's no kind of discriminatory opinions about what to take, what not to take. That's between you and your doctor.
Right.
So once we hammered that out, and I know we had a little bit of a back and forth, you had tried topical, you had gotten off the topical, back on the oral, and back and forth, and then you're comfortable with that, you decided to pull the trigger. And what I would like for you to explain to everybody watching is kind of what your thoughts were. I know that we had talked about you looking at doing this for years, and at the same time as you're getting ready to have a family and taking medicine, not taking medicine. So kind of give us an idea of the thought process, and that's where all those questions came through. What would you go through in preparation to making this decision?
Absolutely, yeah. I'd done exhaustive research, if you will, as part of all sorts of forums for hair loss and everything, and waiting for that next big technology to come out. And so I kept waiting year after year after year of just am I going to be flying to Japan, in a few months to get to have the new thing? And they just kept getting pushed further and further out. And I realized at some point, hey, those things might come out at some point. That's great. I didn't want to wait any longer. So I started talking with Steve, and you really made me feel comfortable with, it's not a typical sales person, which I'm in sales, so there's nothing against that side. But Steve actually told me to wait, which shocked me. I was expecting him to say, nah, don't worry about it, just come on in, let's get this done. And he said, you know what, you should wait a little bit. And that just gave me that much more comfort with dealing with Steve, with dealing with Dr. McGrath, it really sort of helped it to be an open relationship. And when Steve says questions, I mean, there's no way he was ready for it. You know, this is years of questions that I've just wondered, and I just peppered them all with them. And so it was lots and lots of phone calls. But he answered them all, and really made me feel comfortable. And so I knew I had confidence going into the procedure that it was the right time and I was making the right choice with the right doctor as well.
You know, you bring up a great point, and thank you for the kind words. The reality is that I have, of course, a smartphone, and like everybody else, and maybe 10,000, 12,000, 13,000 possible patients or people that I speak to, text with, WhatsApp with, Skype with, all the time, the patients like yourself that watch the videos and have a lot of questions. That's normal. It's funny that you should say that. I actually told you to wait, and part of the method for my madness in regards to kicking the can down the road, not doing the procedure right away, is of those 13, 14,000 names and numbers, guess what? No one's ever called me that I spoke to or texted 5 years ago and said, "You're not going to believe this, Steve. I haven't talked to you in 5 years. I got great news. All my hair grew back." It's never happened. So the way you want to look at this, which is exactly what Christian did, is put this in a perspective of planning a business, planning a family, buying a home. Look at this as what are the building blocks of success, and that's what you did a great job of, and I admire you for that, which I encourage all patients to do. Let's talk about preventatives. Let's talk about, you know, the pros and cons of what you have going for you. You remember I told you you're young, you're healthy, you've got no health issues, you've got strong donor hair. You know, the only downside really at the time is you weren't using the medication, which that then you kicked in. Right. And you have the dark hair and the light skin, which is going to take a little while for this to really look like it's bushing up because of the contrast of the skin color, hair color. It's not a bad thing. Mm-hmm. It's just a fact. So when we look at the pros and cons and we figure, how can we make this better? What can we do to make this procedure even better than what it will be based on the doctor that you choose? I make it clear to all patients, I represent doctors around the country, even outside the country. As long as they're going to deliver and we're not going to have a catastrophe, I'll sign off on that. So you chose, obviously, being in Austin and in Texas, Dr. McGrath, who everybody knows I'm very close to and I have a lot of confidence in. And that was a great decision, but it wasn't ready at that very moment, at that very time.
Right.
But I know down the road you're going to do this at some point. And that just, if I may put words in your mouth, because I'm a patient as well, that's very comforting. That's something that you know what? Steve hasn't called me. Dr. McGrath's office hasn't called me. How the heck did these guys make any sales? And that's the point, is there is no sale to be made.
Exactly.
So when the time comes and the patient's ready, using you as that perfect example, I think you did this on Christmas Eve or New Year's Eve?
New Year's Eve.
New Year's Eve. And I remember you calling me, another question, hey, can I have a drink or two? I'm like, no, you can't.
Yeah.
But you know, it was the right time for you. So here we are, 4 months, and we're seeing exactly what we want to see. Mm-hmm. And I can't wait to get you back here at 8 months, 12 months. It's going to be exciting. I mean, this is the tip of the iceberg. So I should ask before I sign off, any questions for me?
Nope, I think everything other than just how much longer do I have to wait for full?
Patience.
But, patience is that's a sort of a resounding message with me.
Very cool. Well, I mean, you know, I know that we're gonna the team here, the video team is gonna let you do a little independent kind of testimonial here on kind of what you went through. I just wanted to grab you because I was in town. They told me you were coming in and shake your hand and say it's been a journey and it's been a pleasure. And you can, to this day, right, always ask me questions.
Absolutely, still do.
All right, thank you very much.
Thanks
Great
so much,
seeing
Steve.
you.
I appreciate it.